I'm Dr. Nelson Keller. I am a physician at Hampton Roads Orthopedics. One of my specialties is wounds. I've actually been doing wounds for about 28 years and actually ran wound clinic for about 17 years at Mary Immaculate. Miss Samuels presented, it was about a year ago, with wounds on both ankles and lower legs that had been present for over 3 years. These wounds were completely circumferential around her legs, measuring approximately 19 centimeters by 10 centimeters by 1 centimeter depth. We initiated some local care. She did have a significant amount of drainage, so once we were able to do some local care, clean up the wounds with some debridements, we started using the TheraSkin allograft along with a wound vac due to the amount of drainage. Since that time, we've now got this wound down to about 3 centimeters by 2 centimeters. So she's on the way to full recovery. She no longer needs the wound vac. She has minimal to no drainage, and very pleased that she's able to get back to a active lifestyle.
My name is Gracie Samuels. In a few days, I will be 80 years old, and I have been seeing Dr. Keller since last July. I have been seeing Dr. Keller for the wounds on my both lower legs. It started out with the left leg, and that got increasingly larger. And then I had nothing on the right leg. And then in a few months, I had a scar on the right leg, and I thought I had struck my leg on the dishwasher door. But one of the doctors that I was seeing told me no, it was poor circulation. So I have been dealing with these ulcers for about 3 years now. Before I came to Dr. Keller, I saw about 7 different doctors. I had so much drainage. When at one point, the wounds just drained so much, and I had to change them in between. I had home health care for a long time, and the nurse and aides were coming out to dress the wounds. But I had to dress the wounds in between because it was so much drainage. So how I got to Dr. Keller, one of the nurses at Riverside referred me. I look forward to coming here. I live in Newport News, and I actually look forward to Wednesday coming here, seeing the wounds and seeing how much they have healed each time. The left leg ulcer is smaller, and each week that's smaller. And the right one, at one time, it was all the way around my leg. And now that's all healed except one small spot on the right side, and that's what we're working for, healing that. The staff, Dr. Keller, everybody's just so friendly and helpful. I am so glad that I came to see Dr. Keller, and I would suggest anyone with any problems, foot or ankle wounds, to come and see him, because he is definitely the person to see and to heal your wounds. I have been very, very happy with my treatment.